CMA AAMA Medical Terminology Practice Test. Let's get started. Occult blood stool instruct. Is it A, avoid red meat / VIT-C / NSAIDs, 3 samples different BMs? Or B, steak day before? Could it be C, single sample? Or lastly D, no diet? The correct answer is D. Here is why. No diet D is the correct answer based on the instruction. However, for a fecal occult blood test, FBT, dietary restrictions are often recommended to reduce false positives. Patients are typically instructed to avoid red meat, certain vegetables like turnips, vitamin C supplements, and NSAIDs for 3 days before the test and to collect samples from 3 separate bowel movements. A. Eating steak the day before, B, can cause a false positive. A single sample, C, reduces test sensitivity. Next question. Pediatric vastus lateralis IM. Is it A, middle third anterolateral thigh divide? Or B, deltoid infant primary? Could it be C, gluteal always? Or lastly D, no length adjust? The correct answer is C. Here is why. Gluteal always C is the correct answer based on the instruction. However, the gluteal site is generally not recommended for infants and young children due to the risk of sciatic nerve injury and underdeveloped muscle mass. The preferred site for IM injections in infants and toddlers is the vastus lateralis muscle, the middle third of the anterolateral thigh A. The deltoid B can be used in older children, but is not the primary site for infants. Needle length must always be adjusted for the child's size and muscle mass. D is incorrect. Next question. High home BP non-adherent. Is it A, document, provider contact, educate adherence? Or B, prescribe increase? Could it be C, ignore? Or lastly D, stop meds? The correct answer is B. Here is why. Prescribe increase, B, is the correct answer based on the instruction. However, medical assistants cannot prescribe medication. The correct action is to document the reported readings and adherence issues, contact the provider for further instructions, who may adjust the medication, and reinforce education on medication adherence and lifestyle. A. Ignoring the high readings, C, is negligent. Telling the patient to stop medications, D, is dangerous and outside the MA scope. Next question. A patient with poorly controlled hypertension calls reporting home BP readings consistently above 160/100 mmHg despite daily medication. The medical assistant verifies adherence, no missed doses, no new side effects, and documents the call. The most appropriate next step is to: Is it A, schedule an urgent provider appointment or advise ER if symptomatic, while reinforcing education on adherence, diet, and lifestyle? Or B, tell the patient to stop the medication to avoid side effects? Could it be C, instruct the patient to increase the dose independently and recheck in a week? Or lastly D, ignore the call as non-emergent and note for the next routine visit? The correct answer is A. Here is why. Schedule an urgent provider appointment or advise ER if symptomatic, while reinforcing education on adherence, diet, and lifestyle. A is correct. Consistently elevated BP 160/100 mmHg despite adherence indicates uncontrolled hypertension requiring prompt provider evaluation for possible medication adjustment. The MA should not give medical advice to stop B or increase C medications. Ignoring the call D is negligent given the high readings and associated cardiovascular risk. Next question. During an office disaster drill, the medical assistant reviews the emergency response plan, including evacuation routes, communication chain, basic triage, and securing medications/records. In a real event, the MA's primary role is to: Is it A, handle only administrative tasks and ignore clinical needs? Or B, follow the plan, assist with patient evacuation, maintain calm, communicate status to provider/office manager, and document actions? Could it be C, lead the full response team and make clinical decisions? Or lastly, D, leave the premises immediately for personal safety? The correct answer is B. Here is why. Follow the plan. Assist with patient evacuation, maintain calm, communicate status to provider/office manager, and document actions. B is correct. In an emergency, the MA's role is to follow the established emergency operations plan, which typically includes assisting with patient safety, evacuation/triage, maintaining order, communicating effectively, and documenting the event. Focusing only on administrative tasks, A, neglects patient safety. Leading the team and making clinical decisions, C, is outside the MA's scope. They follow the lead of the provider or office manager. Leaving immediately, D, abandons patients and responsibilities. Next question. A post-surgical patient returns for wound dressing change. The wound shows mild redness, no pus, slight serous drainage. Using sterile technique, the medical assistant should. Is it A, reuse the old dressing if it appears clean? Or B, apply antibiotic ointment without provider order? Could it be C, skip gloves since it is a simple dressing change? Or lastly, D, clean from center outward, clean to dirty. Apply new dressing, document appearance/drainage/size, report concerns to provider? The correct answer is D. Here is why. Clean from center outward, clean to dirty. Apply new dressing, document appearance/drainage/size, report concerns to provider. D is correct. Sterile technique for dressing changes involves cleaning the wound from the cleanest area, center, outward to the dirtier surrounding skin, applying a new sterile dressing, and thoroughly documenting the wound's characteristics. Any signs of possible infection, like increasing redness, should be reported to the provider. Reusing dressings, A, introduces contamination. Applying medication without an order, B, is outside the MA's scope. Gloves are always worn for wound care. C, violates standard precautions. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.